And we conducted a number of studies on the mental health impacts of COVID-19 across the UK. And what we actually found when we looked at the data specific to Northern Ireland, we found that approximately 30% of people in those initial stages of lockdown were reporting clinically significant levels of depression, of anxiety, and of post-traumatic stress disorder. And then we had a look at, of those people who are reporting clinically significant mental health impacts, are there special or specific characteristics that identify these people? And again, what we found was that those who were more at risk were the younger people, so the younger age groups, those who had any sort of pre-existing mental health condition or complaint, and those with high levels of exposure to media around COVID-19. When we live in this situation where we're in lockdown and people experience stress in the external world, so they're told that the virus is there and there's a threat to them by being in that outside world, then people can have this tendency to detach themselves from that outside world. Of course, the lockdown restrictions make us do that, but there's an extra level of detaching from other things in the outside world. And actually, once people do this for a long time, it's quite hard to then reattach to the outside world. And this leads to people kind of self-inflicting further social isolation. It leads to people becoming lonely. And we know that increased levels of loneliness can impact on mental health and increase rates of poor mental health. So I think with taking all that into consideration, psychologists around the world are increasingly raising concerns, and I would do this as well, and raise concerns that actually the impacts that COVID-19 will have on people's mental health will be much longer lasting than the pandemic itself.
It clearly it did plug some of that gap, and people could watch live sports on telly, which helped with their fandom and engaging in the sports again. But you can't quite beat live sport and attending venues itself. So for many people, I still think that they probably struggled with that lack of live sport, the whole ritual of going down the pub with friends or talking about the sport or the game with different people and everything that goes along with the live sporting event experience. I think, as I say, it was probably a progression and a positive thing, the return of sports on TV. But for many people, it probably didn't go far enough for them. And I think it'd be interesting from a sporting perspective, as the sports come back and as fans get back in the stadium, as we begin to engage in sports clubs, sports lessons, competitions ourselves, I think we'll bounce back quite quickly, actually. I think in some ways it'll be quite a positive thing in that we'll really realise just how lucky we are to engage in sport and to go to these live events. And I'm hoping that normality will return quite quickly, but everybody is different.